Hello, I'm Dr. Robert Lelouch, a board-certified OBGYN physician with over 30 years of clinical experience. Today we're going to talk about endometriosis. Endometriosis is a problem that occurs in approximately 10% of women and can be mild or can be quite severe. Has a range of symptoms and problems, and it's a pretty big topic, so I may divide this lecture in more than one video, but basically it can cause discomfort with periods extending before and after periods. It can cause pain with intercourse. It can cause abdominal pain. It can cause pelvic pressure. In fact, 70% of all women with pelvic pain with nothing that can be found on exam or imaging tests end up having endometriosis. That's right, most of the time there's no sign that you can see on an ultrasound or a CT scan or an imaging test. And there are hints on exam, pelvic exam, but nothing definitive. So the only way to know for sure is with a laparoscopic exam. That's a little incision in your belly button. Look inside with a camera and a fiber optic scope. There's a separate video on laparoscopy. So what exactly is endometriosis? Well, the lining of the endometrium is called, the lining of the uterus is called the endometrium. And that tissue gets thick in preparation for pregnancy. And it's a rich garden for the egg to implant in and grow. And when there is no pregnancy, that is what comes out for the period. So the period is more than just blood, it's actually the lining shedding. Well, that tissue somehow gets outside of the uterus. And most presume that it goes through the fallopian tube and falls into the pelvis behind the uterus is most common place. That tissue starts to grow there. It responds to hormones, gets thick in preparation for pregnancy, and when there is no pregnancy, it bleeds, it sloughs, but it doesn't have an exit. It sits there inside the abdominal cavity, and that causes irritation. The body doesn't like bleeding in there. It causes scarring, it causes adhesions, it causes things to stick that shouldn't stick. It causes the intestines to stick together, so it can add to bowel problems or digestive problems. It can stick to the bladder, cause bladder issues, can even invade into the bladder, cause rare urinary problems or even blood in the urine. In fact, it can rarely spread anywhere in the body. There's occurrences of it happening in C-sections, incisions, or in the lungs, causing some coughing up blood once a month around period time, or in the eye. Those are really rare circumstances. So that's the mechanism for what is endometriosis. Why does it happen? We don't really know. We don't know, but there are ways that we can make it better. So if it's irritating things, if it causes damage to the tubes, for example, that's how it can cause infertility. There are, even if there aren't damage to the tubes, perhaps the inflammation around the area can cause a decreased chance of fertility. Some of the treatments are things that suppress hormones, that decrease them so that, or regulate the hormones, just as, for example, the birth control pill makes periods lighter, it can also suppress and decrease discomfort from endometriosis. Progesterone birth control methods can as well, like the IUD or the Depo-Provera shot. They're not quite as effective as other methods, but they can work. Pregnancy, if you get pregnant, can often have a beneficial effect on endometriosis. If a woman has endometriosis, or we think it might, and none of those first-line measures work, then we often recommend a laparoscopy. We look inside with an incision. If we see it, then we fulgurate it or destroy it. We can use a laser, we can cut it out, we can use something called a harmonic scalpel with high-frequency vibrations that gets rid of it, and that gets rid of the big implants, but it doesn't get rid of the smaller microscopic bits of it that we don't see. And for that reason, we often add a hormone blocker afterwards. And that temporarily shuts off your hormones, like it's called medical menopause. And it can have some side effects like hot flashes, mood swings, vaginal dryness, poor sleep. However, can also extend the success rate of the surgery for endometriosis. So if you get a laparoscopy for endometriosis and we see how you're doing in 5 years, 60% of women are still happy 5 years later. But if we add one of these hormone blockers, then that can go up to 90-95% success rate. So those are something called Lupron, or Orilissa. It's another, which is Relogolix. Those medications work similar to block the hormones. They can be given for endometriosis without a laparoscopy. I'm not a fan of that because of all the side effects, but if the diagnosis is pretty clear, it's an option to try that without having the formal diagnosis of a laparoscopy. The treatments might go on for 6 months or up to 2 years, depending on the dosing, depending on whether the pain is pelvic pain with or without intercourse. So lots of variables there. Certainly a topic to discuss with your provider. Bottom line is that if you're having some of those symptoms we outlined in the beginning, then that's one of the potential causes, and you'll need to see your physician to get on the path to resolving it, to figuring out what's going on and making it better for you. I hope you found this information helpful. Please leave your comments. Thank you.